Hi there. My name is John Jones. I am the data analyst reviewing the information here to help decide on just specific states that we may need some extra staffing for hospitals during the influenza season. Uh, Here we gathered data from the census for our population counts as well as from the CDC for our death counts in each state. They were giving primarily in group ages of 10, so 0 to 5, which most of those were kind of left out anyways, as well as 5 to 14, 15 to 24, and so on and so forth. So this is what we've come up with so far based off of that information to get a better idea of when the flu season is, what our vulnerable states are, and what the vulnerable population is. And our original hypothesis was that our vulnerable population would more than likely be individuals, patients age 65 and above. That would be the most likely cases where we would need the extra staff, and we'll get to see that here in some of the data we've come across. So again, our goal is to help provide extra staff to hospitals across the U.S. during flu season. Uh, Again, we'll just kind of see what here that information shows us. Um, Objective: determine the location with highest casualties from influenza. Again, we've everything we've found in this data so far, and this is looking at all 50 states, including Puerto Rico, so all U.S. territory. So we'll move on here to flu season. So here we have just the top 5 states where um, where we see the highest peaks. So I've left it up so that if we would like to, we can review other states as well. Just as an example, if I wanted to know here in Kansas, which is where I live, and there now we've added Kansas to our list as well, and we can see for each state if we wanted to look at some other ones. Um, but here's our top ones. We have California, New York, Pennsylvania, Florida, and Texas. And here, these peaks, this time in between, this is range from 2009 until 2017. So if we look here, we start to see a peak here in California. So there's our lowest in September, and we start to see that rise starting just in October. And that's for every state following as well. So October to November is probably the time frame that we're going to want to start sending extra staff out to help those states up until we start to see it decline here in February. At least until the end of February is where I would say then we would want to start bringing stuff back, or beginning of March. So right around that time frame, we'll see that decline, so it won't be as bad. So here's 2013, and as we see again, it just starting up again, going into 2014. All of our peaks coming right in January for each state. So we know that's the time frame that we can cover when we want to have staff to. Here is our forecast at the end. Again, we see that peak, so it just gives us a little more verification that, that's the time frame we want to be looking at. So here's just kind of a map overlook of similar information. Again, I've highlighted uh, the year 2017 just because that is the most recent information that we have. And of course, the lighter blue, those are kind of the states with the lower death counts, whereas the darker, then we have higher counts. So here we see a little more California, South Dakota, New Mexico, Illinois, and then of course New York and Florida. There's a few different ones here that are a little bit on the darker side. Massachusetts there, a little bit on the higher side. And that's just from, again, 2017, our most recent year, which you could see a little bit in in the last report for the flu season. Just it may not reach as high certain years, but again, those are just kind of the last one gave us a little more specific as to which ones peaked the most frequently at the higher numbers. Uh, we're kind of taking it with the location of these states, that states with more humidity and the higher population, such as California, Florida. Those are very popular locations for patients age 65 plus. So here we're taking a look at the vulnerable population. Again, these are states with the larger population of patients age 65 and over. The same color scheme is applying to this, where the lighter colors are, of course, not as many, as well as the smaller circles, and then darker, larger circles, those are where we see the largest count. Here's California with just over 4.5 million. Here's Minnesota with about 3.8 million, which is on the higher side, but they don't seem to have that high of a mortality rate, so it doesn't completely fit into what we were initially looking at with the hypothesis. But we have Ohio, Florida, 2.1 million. That one's a little higher up there. Um, so again, it has been a little bit different with maybe the population and mortality ratio, but it is still fitting in that most of the mortality rates are from individuals 65 and plus. So here I have for my recommendation. I believe that we should focus. Sorry, it's not letting me scroll down here. Focus extra staff to the states that have those higher mortality rates with patients age 65 and over. The staff should be provided, from the start of the flu season in October until right about end of February, beginning of March timeframe. And we should consider even more staff potentially for those peaks in January. So maybe, for just the first couple of months, providing support to, of course, those states with the higher numbers, but maybe come end of December, beginning of January, we really look at providing even more staff to those states just to help them get through that. I know that with the holiday being around, of course, families gathering together, it's an easy way for a disease to spread. So something that should definitely be considered. That's all I have for right now. I appreciate you listening and appreciate you joining along. All right.